I'm Rebecca. I'm an occupational therapist, work in the Cancer Breakneck Hospice and cover for Winchester Hospice, and that's supporting the daycare service and our community patients. I became an occupational therapist and my first job was back in 2010. Now, to be honest, I never knew what an OT was. It wasn't until year 10 where I went to a local hospital where you had all different MDT members, and part of that, one of their talks was from an occupational therapist, and I thought actually this is for me because I've always wanted to help people. So a typical day for me is I start at 7:30 in the morning just so I can have the morning handover from the night staff. And then the rest of the day can involve some different meetings. I then work out in the community, so that's seeing people that might need visits, could be seeing them from a mobility side of things, that's getting them on and off chair, bed, and seeing if they need any equipment to support their needs at home. Here in Andover, where I work, we have patients that come in for symptom control. That might be they've been admitted from home or from one of our other hospitals in Hampshire Hospital, as an example. They may actually be for end-of-life care. Some people might need to come in for an iron or blood transfusion. It's just that's because it can't be done at home and they need that acute admission, and hospice might be the right environment, and especially if we've got a bed, they don't need to go into hospital. And the length of admissions could be literally just a day admission, or it could be a couple of days into week depending on how things are, and especially when it comes to discharge planning, it's then when care or a care home becomes available. If you want to be an occupational therapist, actually you could go to local hospitals, reach out and see if there is any work experience you can do, because then that will give you the opportunity, is that something you want to commit, especially if you need to go on to university, because you don't really want to lose 3 years and then find it's not for you. And actually reach out to local hospitals, you might find hospices, they might be able to give you a bit of work experience, placements, and get that varied experience before even you think about being a specialist OT or where you want to go. Once you've progressed even further through a band 5, which is your first role, just trial different areas and see what works for you, really. The bit I love about my job is that I do work with patients in the community and here as the inpatient. So there's numerous patients that I can actually join in that patient journey. So I might have actually seen them at home, but then they come to the hospice for instance, control of their pain. And they also need my support because their needs have changed to get back home. And then I can continue their care again at home. So I feel on both sides it's good because you both know who you're talking to. You're not starting the journey back from day one, so you're not feeling like you're repeating things. You get more of a rapport with the family and also the patients. And you're there, so I like that journey that you flit in and out of their journey where it's needed, and we've got that familiar face where they need it really, so I do love that side of things.